Hello and welcome to CIBER Focus, your source for international business information. My name is Tim Smith and our guest today is Dr. Onalenna Seitio-Kgokgwe. Onalenna is the country director for Botswana at the Institute of Development Management, which was established in 1974 to help meet the management needs of Botswana, Lesotho, and Swaziland region. Onalenna has studied in nursing and public health, and has received her PhD from the University of Otago in New Zealand. Onalenna recently co-authored a paper on understanding human resource management practices in Botswana's public health sector. It's found in the Journal of Health Organization and Management. Today, Onalenna will draw from her many years of experience to talk about healthcare industry in Botswana and how the Institute of Development Management is working to improve healthcare management in Southern Africa. Onalenna, thank you so much for joining us today.
Thank you so much, Tim.
And welcome to Bloomington.
We appreciate.
Oh, it's our pleasure. To begin with, can you give us an overview of the state of healthcare in Botswana, and what are the challenges you're currently facing, and how does IDM support public health in Botswana?
Okay. The Botswana health system is one of the best in the region for a number of reasons. Firstly, there's political will from the government. Therefore, the government has invested so much in health. The infrastructure is actually very good. We have some of the best hospitals in the region. If you look at the population in terms of physical access, over 80% of our people can actually walk to a health facility. And the healthcare system is almost free. You know, to get access to services is almost free because the government is financing the health system. We have done very well as a primary healthcare-oriented health system. We are the first country actually to run a national free access to antiretroviral treatment nationwide, which was really something that was really commendable on our government. And also currently we are one of the first countries also to treat all patients with HIV, irrespective of their CD4 counts, which is also something that is out of the ordinary in our region. So I think the health system is very good. When it comes to challenges, you find that there are issues of the health system as a system, not really in terms of the resources.
Okay.
You know, like finance is not an issue in Botswana, the infrastructure is not an issue, but other system issues like the human resource capacity, like the health information system, like availability of medical products and medicines. These are like our challenges. Of course, with the economy, we are also now starting to think about sustainability of the health system. And therefore, issues of creating a health financing strategy becomes really very important. So this is where we are. So as IDM, we are really focusing on health system strengthening, especially on the issue of capacity building, especially for public health. So we run a number of public health programs in order to support the human resource development. We also run a number of consultancies in different areas, especially program evaluation in order to support the programming. We do a number of research studies just to provide that evidence that is needed to make decisions on the programs and policies. So basically, that is where we are as an institution.
Botswana has seen the death rate due to AIDS virus fall over the past decade. But unfortunately, the prevalence has risen over that time. How has this affected the healthcare industry and overall development of Botswana?
Yeah, it is really actually expected to have a high prevalence when you have a treatment program like the one that we are having, because now we are keeping our patients alive instead of dying because of HIV/AIDS. But the challenge is that now HIV/AIDS has become a chronic disease. Therefore, we have a lot of people who are in the system who really need a lot of care and treatment. And therefore, this is really putting a strain on our financial resources as a country. And it is also affecting the human resource capacity that is already limited. It's actually becoming overstretched because of the burden of HIV/AIDS. In addition to HIV/AIDS, we also have non-communicable diseases that are really increasing, and therefore the burden, multiplies. Yes. So that is the challenge that the country is having right now. The need for medicines. And I also have to hasten and say Botswana, unlike many of the African countries, is really not getting that much of donor support. So most of the resources have to be the national resources that are supporting all the health programs.
Okay, thank you.
Yeah.
What opportunities exist for the private sector, both internationally and domestically, to get involved in Botswana's health sector?
Like we always talk about the building blocks of a health system. You find that in every building block, there's an opportunity. If you look at the issue of medicines, for example, Botswana doesn't manufacture medicines. And probably even in the region, there's limited manufacturing going on. So we do need the private sector to come in there and actually do the manufacturing for the country and the region as well. And then you look at issues of human resource development. That is where we need, partnerships like the IU, where we actually partnering to work on, building the human resource capacity in many different aspects in public health, business, community development, you name it. So we really need the private sector to come in there. As well as the provision of services itself. We do have these beautiful facilities, but sometimes when it comes to expert or specialist services, we need the private sector to actually take a lead in actually providing some of the hospitals, the health services. The government is actually opening up to the private sector to actually use the public health facilities to deliver the services, and that is where we feel really the private sector has to come in and lead in terms of services that are specialist.
Well, I hope that happens to definitely help build out what you're trying to achieve. And Onalenna, I wanted to thank you for coming in and speaking with us today. That's all the time we have. Again, welcome to Bloomington, and thank you for spending some time with us on the Bloomington campus.
Thank you so much.
I wish you safe travels home. It's been a pleasure getting to know you.
Thank you.
Thank you.
Thank you.
That's all for this edition of CIBER Focus. Thank you for tuning in. If you have any comments or suggestions for future topics, please let us know at CIBER, that's CIBER, @indiana.edu.